Basically, everything you do or experience can affect your blood sugar levels, from nutrition and physical activity to stress and illness. Some things cause your blood sugar to rise, and others cause it to drop. When you don't have diabetes, the body is able to effectively deal with these fluctuations and regularly bring your blood sugars back to a normal, safe level. But when you live with type 2, the systems that regulate blood glucose aren't working properly. This makes it challenging to keep glucose within a healthy range, and you need to pay a little extra attention to all the things that impact blood sugar. One way to keep track of your levels is by using blood tests. If you're working with a healthcare provider to manage your diabetes, they'll probably ask you to do some lab work every few months to see what your levels are like. But what about between lab visits? How do you know what's happening with your blood sugar? There are a few different types of glucose monitoring devices that can help you test at home. Some require you to prick your finger and test a drop of blood. Others use sensors that are inserted slightly under your skin. Some you scan with a device, like your cell phone, to enable readings, while others keep a running log of your glucose levels in real time, day and night. The whole testing routine, including whether you need to test in the first place, what device to use, and when and how often to test, can really vary from one person to another. Your routine should be personalized to fit your needs. A diabetes educator, your doctor, or a community pharmacist can help you figure out a plan to match your treatment goals. There's no one-size-fits-all approach to living well with diabetes. The point of testing is to compare your blood sugar levels to research-based target ranges, which are recommended to help people with diabetes stay healthy and minimize risks. Glucose results from the lab and from self-monitoring provide information that you and members of your healthcare team can use to guide treatment plan decisions and management strategies. You want to be a little like Goldilocks when it comes to your blood sugars. They need to be just right, not too high or not too low. More specifically, the target range for blood sugar when you're fasting, first thing in the morning, or before a meal is 4 to 7 millimoles of glucose per liter of blood. After meals, the target range is 5 to 10. When you get lab work done to check your A1C, which is like a 3-month average of your blood sugar levels, most people are aiming for 7% or less. Everyone's a little bit different though. So if you have access to a healthcare provider, they can work with you to figure out your personal targets. Sometimes when your blood sugars are high or low, you don't feel anything strange at all. But many people do experience telltale signs of high and low sugars. High blood sugar, also known as hyperglycemia, can make you feel tired, really thirsty, or that you need to urinate more often. Hyperglycemia can result from many different things, including the type or amount of food you're eating, your activity level, feeling sick or stressed, or a side effect of some medications, just to name a few. If you let hyperglycemia go unchecked for too long, it can get pretty dangerous. Over time, high blood sugar can damage nerves and blood vessels and lead to issues with various body parts like your heart, kidneys, eyes, and feet. On the other hand, low blood sugar is called hypoglycemia, which can make you feel shaky, lightheaded, sweaty, or confused. Hypoglycemia can be caused by anything that uses up the sugar in your blood, like being physically active, not eating enough carbohydrate-containing food, consuming alcohol, or taking too much of certain types of medications. Having low blood sugar can have a pretty immediate impact on your health, such as passing out or seizures in extreme cases. So it's important to keep track of whether you're at risk for hypoglycemia, because not everyone is, as well as know the signs and symptoms and have a plan in place for treatment if you dip too low. The dangers of hyperglycemia and hypoglycemia can sound pretty scary, but they're just something you'll learn to navigate and correct for as the captain of your diabetes journey. At first, you might feel a little lost at sea when it comes to keeping your blood sugar levels in a healthy range. That's totally normal. But day by day, you'll become more comfortable with living your new normal, thanks to your diabetes knowledge and management skills. And you can always check out the Diabetes Canada website to learn more about guidelines for tackling high and low blood sugars. So now, I'm going to issue a challenge to you. Get to know your personal target glucose ranges. Pay attention to how you feel with higher and lower blood sugar levels. Make a plan for if, how, and when you'll test, and brainstorm some small changes you can make to help achieve and maintain your personal targets. I know you can do it. Thanks for watching this episode of How To Type 2.